what do you think the future of psychiatry is? I mean, you're on the cutting edge of, of functional care, but when do you think your colleagues catch up and come into this century of understanding that diet, lifestyle, nutrition, nutrients matter?
Well, I'm quite convinced things are changing. I'm optimistic. You can get a fellowship now in lifestyle medicine. So you can take a 2-year program after you graduate a fellowship and learn that sleep is good for you and exercise is good for you. And maybe you should help patients, eat more vegetables. But anyways, it's there. And there are mindfulness programs at Harvard and Stanford where you can get training in. So people can appreciate the lifestyle. What's taking a little more time, but it's slowly happening, is the role of some of these micronutrients in mental illness and the role of functional medicine in mental illness. But based on the interest in our teaching program and the community of young psychiatrists, I mean, they're taking supplements to support themselves. They want to know how they can help their patients.
Do you think it's a generational piece? The newer docs coming through are more likely to be interested in this?
I'm seeing a change, yeah. And just the fact that more and more medications hasn't meant improvement in mental health care, right? Rates are going up. Suicide rates are going up. Depression rates, anxiety rates are all going up. So our current model, right, symptomatic-based psychopharm, psychotherapy has not made a dent in some of these major mental illnesses. So I think the model of care is slowly going to shift.
Yeah, what do you see as being the next big step forward? Like, or is there one, or is it just a slow transition from, from current beliefs to, hey, this is not working, and now our feet are being held to the fire to have evidence that, what the American taxpayers are spending healthcare dollars on actually has an outcome that favors the population's health.
Yeah, the fact that it's not working never has really helped the field of psychiatry. They'll just kind of shift to another mechanism or explanation. I think what is helping now is the research and the good news. People are obsessed with gut and bowel function. So we have great research on, probiotics and gut microbacteria affecting the brain. And there's just ongoing research on diet, major universities looking at the ketogenic diet and mental illness. So there's slow changes within the academic community. What's frustrating to me when I talk to young doctors, they're not getting this in their education, but the research is happening.
So schools still have, at least with the doctors that have spoken with, they're still not teaching it. They're still not implementing it in the curriculum.
No, not at all. I
Not at
mean,
all.
sometimes you can take an elective, an hour course in, you know, mindfulness or an hour course in something else, but it's not built into any training program. Both for nurse practitioners and psychiatrists, you know, those groups are seeing most of the mental health patients.
So then really, if a doctor wants to pursue this, they have to do postgraduate work
It
beyond.
takes, yeah, absolutely it takes the right person who's committed to improving outcomes, and it takes their own funds oftentimes and their own time. So it's a unique group that's been, training with us over the last 5 years, and it's just too bad it's not part of our curriculum.
Now you have training program, postgraduate program, right, with faculty that helps doctors kind of move in this direction.
Yeah, the education platform psychiatryredefined.org. We have free webinars. We have one coming up, I think, next week on lithium. We have short programs, 4 weeks. And then most of our training has been a year-long fellowship. So helping people over the course of a year learn this material so they can integrate into their practice. It's very hard to go to a conference and all of a sudden start prescribing, magnesium B12 and SAMe and all these other nutrients.
Yeah, that's fantastic. So fellowship where doctors can have mentorship as well and education. Is the fellowship has a mentor piece to it?
Yeah, there's live supervision groups, and then there's small mentoring groups, as well as the recorded content. Yes.
Nice, nice. Yeah, that well, I mean, to me, that's thank you. That's definitely helping. Have you trained a lot of doctors through your program? You said for the past 5 years you've had it going.
Yeah, we've probably had close to 1,000 so far, 16 different countries in the full fellowship. And then we have lots of smaller programs, probably had over 10,000 people, take some of our courses or our content. So people clearly want the information. We just got to translate it into, that it's part of psychiatric treatment. It's not alternative medicine.
Yeah, I think that's well said. I mean, the shift, yeah, historically it's always been fringe alternative. What's this vitamin stuff you're trying to do? That's not science. And what I just heard you say is that that needs to be incorporated in the mindset of mainstream care and not as fringe or alternative.
Absolutely. Yes.
Yeah, love it. Well, this has been great. Very, very enlightening as well as just very helpful because I see how mental disease decimates families and turns people's lives around. And so to have somebody like yourself and doctors around you being trained to really assess people more holistically with nutrition, it's just a relief. It's a breath of fresh air to have a conversation with you.
Great. Well, thank you, Peter. Appreciate your work. And I think the word hopeful is really important that you use because so much of our mental health model is just, one medication after another, and patients and families feel anything but hopeful. But I do think functional psychiatry is a path where people can look forward to feeling better.
Absolutely. Well, Dr. Greenblatt, thank you so much for your time today. And thank you for all the work and effort you're putting into helping the world become a better place.
Great. Thank you, Peter.
Thanks.